Hello, everyone. So I was looking at an article, and it's pictured here. It has a video, but I'm not gonna concentrate on the video right now. I just wanted to show you this article of this bold move that this healthcare worker made in this article. So it's a healthcare workers that blocked the Denver protesters calling for an end to the stay-at-home orders. And so as you know, or some of you probably, if you don't, if you haven't really been paying attention, and I know most people have been paying attention because there's so much going on right now, that in the news they're showing a lot of people that in pockets of areas that have been protesting the stay-at-home orders, they've been defiant, blocking traffic, rude, yelling and screaming at people, and pretty much wanting to break the quarantines. And the quarantines are meant to try to protect people so that people could kind of hunker down a little bit longer and stay isolated away where at least they have some safety net of protection and go a little bit longer, so that in hopes that the longer that they stay away from some of these places that are like high touch areas or high trafficked areas where there's lots of people, that maybe we'll get closer to, test, maybe more treatments will develop, because right now a lot of scientists, a lot of people that are all over the world in the healthcare profession are scrambling to try to figure out ways to try to combat this virus, because from what I've read thus far is it may be something we may be looking at for about a period of 18 months. And I'm just going to put my input of what I've been reading, because I've read plenty of articles and done plenty of research on it of my own, that there may be rolling lockdowns. And what rolling lockdowns are is when, if they gradually, like, there's phases, if they gradually reopen some of the businesses, and if there are hotspots, in other words, hotspots where there might be a resurgence of outbreaks of COVID-19, then those places will be locked down for a period of time. And then when those outbreaks calm down, or they see less and less incidences of the outbreaks happen in those areas, then they'll reopen gradually and slowly up again until finally it comes to a point where they finally have less and less outbreaks. Then they can open more businesses, and in hopes that they prolong this on till they find a vaccine that is in large quantities that many people can have access to. And so I believe that's how this thing is going to play out. But many people are worried. There's a lot of uncertainty. There's a lot of job loss. And what I've seen, it's hurting the low wage workers, and it's hurting everybody in some kind of way. But there are people who don't like being shut in, they don't like being locked down, and they don't like not having control of their life and feeling as though that they're not going to be able to pay their mortgage and their bills and their rent. And so some people are working part-time jobs. Some people have the luxury of working at home, but however, that's not everybody's situation. And so I understand that fully. But what they're looking at is, if they have people to open everything up and go as normal as if the pandemic is not happening, what could happen is a resurgence of what we just saw in New York, and there'll be more hotspots, and then more people will fall ill, and possibly more death, and a lot more death than even what we have seen in the past few weeks. And so that's the reason why they're doing the stay-at-home orders, because they're trying to keep as many people as possible safe so that they can start the economy up and thriving again, because we can't have an economy run on people that are ill, on multiple people that are ill, or if people are so sick that they die. We won't have an economy if we have many people to die off. And so that's what we saw in New York, we saw where it seems as though the way this virus operates is when there's large groups of people clustered together. And in New York, it was kind of difficult because New York is really a city, urban epicenter. It's thriving. It has a lot of places that are high rised, and they have elevators, and people live really relatively close together. So it's hard to social distance when you're in a population where everybody's riding on the subway and what have you. And so that's the problem, I believe, that was persistent and was an indicator as to so much death. Not only that, if it already outlined, um, if you look at the health professionals, they outline some of the characteristics of what people might have already had pre-existing illnesses. They might have been of a certain age group, and that you were at higher risk of death. And so the mortality rate was through the roof. And it seems as though that people want to be defiant and break these stay-at-home orders. And it you know we're here in America, and it's supposed to be the land of the free, but whenever it affects other people's lives and it affects other people's health because you're making bad decisions, it's like we're all going to jump off the cliff because you decide you want to jump off the cliff. It's not a fair assumption to make people feel as though they have to take that risk because you chose to take that risk. It'd be different if we could do that and we could say, go ahead and go work. But they did make an offer. They did have like a lot of these places that are essential jobs open up for part-time so that people can go back to work and work there. But what I'm hearing is that these people, they might be business owners and they don't like having their business shut down for long periods of time. They're used to being the boss or somebody working for them. And so they're in the back somewhere in the office where maybe it's less traffic and it's safer, and everybody else is out on the front. Pretty much, if they're not protected, they're putting their lives on the line. So I don't know if they have a business where they can't really particularly work from home or not. I don't know how that thing is set up because everybody's doing something different. But I did hear that McDonald's had an outbreak where several employees ended up getting COVID-19, getting sick. And what I'm hearing is that they didn't have gloves, they didn't have masks provided to them. A lot of the essential jobs have opened up, and a lot of people are not really biting as much of that because they're in fear that they could be the next victim of COVID-19. There's a lot of fear out there. People are not electively wanting to put themselves in a position where they could be um, the next victim of this deadly disease. So it's scary. A lot of people are in fear. And then there's the other thing. On the other hand, people are in fear of losing what little savings they have. They don't have a lot of money to put food on the table. And so there's a lot of fear going around. But the thing is that that's why they have the food drives. That's why if you're a person that's really persistent about getting out there and going to work, then maybe you should try to take a risk and take the essential jobs if you really want to have some type of income coming in. But it doesn't sound like that's what these people want to do. It sounds like they want to open everything back up, which could possibly put a lot of more people at risk for catching this disease. And so in this right here, it had a video attached. I'm not going to play the video, but it says healthcare workers block Denver protesters calling for an end to the stay-home orders. And I think before I even show this that I'm more for the healthcare workers, because a lot of the healthcare workers in some of the hospitals are afraid to speak out, and those that aren't afraid to speak out, some of them have decided to stay home because they have no protective gear. Some of them have gotten sick with the disease. Some of them have died from the disease. And so they know what it looks like seeing the crises. They've seen multiple people die, multiple people get sick fall ill or have long sustained damage to their lungs and to other body parts, organs, or whatever. Because I'm hearing even after some people come out of this, sometimes they still have problems that are lifelong lasting problems from having caught this disease. So as tensions continue, I'm reading it, the tensions boil over amid the ongoing coronavirus pandemic that has placed large swaths of the nation at a standstill. So, a small group of healthcare workers blocked hundreds of protesters in Denver on Saturday, or actually not Saturday, but it was Sunday afternoon that this happened. So, this was actually yesterday, and it was resulting in a dramatic shutdown. And so, you're going to see photos here. There's still photos. There's a woman, she's holding a sign. She's one of the protesters. She was screaming and shouting. It said land, I believe, land of the free. And so she's a protester that is wanting to go against the stay home orders. And she is not by herself. There are others that are in cars and they're blocking traffic. And so Allison McLaren, a photograph journalist based in Denver, said the medical workers stood in the street to counter the hundreds who had gathered at the Colorado Capitol in an event dubbed Operation Gridlock. Now, this has happened before. I've seen that happen in Michigan. And so it's been all over. I believe they might be even organized on the internet, so they let each other know where they're going to block traffic and where they're going to do their rallies or their event. So the event was met with meant to express frustration with the Governor Jared Polis, who this person has a stay-at-home. It's I believe a mayor. Most of them have been mayors that they are governors that they've been protesting against. So this is the Governor Jared Polis has a stay-at-home order as coronavirus continues to infect tens of thousands of people around the country. And so you see a healthcare worker that is in front of this SUV. And so I'm more for the healthcare worker because they are in a vicarious and a dangerous position where they're putting their lives on the line. Yes, they are working, but some healthcare workers end up having to be relieved of their duties because they've fallen ill to this disease. How long is that going to last? Some of them have complained they are not getting the proper mask and the proper gloving and protective gear to continue their work. Some even say that they've done all the right things and they still wind up getting sick because they're in a high infectious environment where they're surrounded by death and disease and all of these germs, and sometimes they don't even go home to their families because they shower at a hotel or somewhere else because they're afraid that they're going to take it home to their families and give it to their families. So does this woman realize the danger that this healthcare worker and many other healthcare workers such as himself are putting themselves in just so that they can help save lives, and in hopes that it will prolong things a little bit longer, that maybe, just maybe, they will get a vaccine, they will get a cure. Well, viruses, I will say this, they don't have cures for viruses, but they do have treatments and vaccines that they could come up with, and that is the time that they're needing, and that's the reason why they're doing these lockdowns or rolling lockdowns or stay home orders, because they're trying to keep as many of the working class people alive as they can so that possibly we can continue on and not have a whole lot of people ill. And so we also have problems where people don't have health care insurance. And if we have multiple people coming in sick and ill, and most of the lower wage earners, they live in communities of poverty, and more than likely they may have one or two illnesses that are pre-existing, which puts them in a higher category for being at risk of death of this disease. Why would we open back up the country and allow more of those people to fall victim and die of this deadly disease? And so this woman clearly is not really understanding the ramifications of of just opening everything back up. Now, she may look at it as this is America, the land of the free. We should be able to go back to work. And one lady was even yelling that we saved lives too. But I don't know what her job is or what her occupation is, but if they open everything back up and pretend like this disease is not real, we're going to have more death than we saw in New York in the past few weeks in the next coming weeks if we just open things back up as normal. And that's a guarantee because the way this virus acts, it's very highly contagious, and it is like in areas where like multiple groups of people are gathered together and people seem to fall ill, and not everybody does well. Not everybody has the same body where they can come out of this thing and still be alive. Some people's body is made up where they have maybe diabetes, they might already have problems with their lungs breathing. There's young people who think they can't get sick. Some young people have asthma. And so if they get this disease, I hear that it is not a joke, that it is very fatal to some people. So Huffington Post has not been able to identify the healthcare worker seen in the photograph above, but the video that was taken at the scene showed the one man dressed in a scrub outfit standing calmly in front of the line of cars as a woman was holding a banner reading Land of the Free and screamed at him. She was yelling at the top of her lungs, "So you go to work? Why can't I go to work?" So I believe she was the woman that I was referring to earlier. And so I save lives, I save people's lives too, as she exclaimed. So this Mark Zen, the two nurses, I guess he had took video, and it's here on Facebook or Twitter. So two nurses who have witnessed firsthand the toll of COVID-19 is taking in Colorado stood up peacefully to counter protested these people. So here is how they were treated, and I had to join them. And so actually this was a Mark Sen, and I believe I would have said myself, yeah, I'm for the healthcare workers because they're putting their lives on the line so that in hopes that maybe we would get closer to a vaccine or a treatment. And I just think that the people wanting to break the quarantines are really putting a lot of other people's lives at risk. If you want to go out there and choose to put yourself in a position like that, they did offer essential worker jobs that are opened up if you're that worried about income. So you put yourself in the shoes of these people. Volunteer. Why don't you volunteer for a week in a hospital and see what these people go through before you start yelling and screaming at them? So anyway, I'm going to read the rest of the article and try to see if I can play this video at the end of it. But it says Colorado is now currently under a stay-at-home order until April the 6th, and Denver has an extended version in place until the end of the month. And to date, Colorado has experienced more than 9,700 cases of COVID and at least 420 deaths. So the U.S. as a whole has seen more than 761,000 cases and more than 35,000 deaths. So in addition to the deaths and the sickness, the outbreak has wreaked havoc on the economy, and some 22 million people filed for unemployment benefits in the past 4 weeks, the worst period of the joblessness in American history. And I believe that since the Great Depression, even they were saying, despite the landmark $2 trillion stimulus package meant to avert some of the pain of the financial crisis, some Americans who are running out of money have grown frustrated with the slate of the social distancing measures designed to save the lives and stop the spread of this disease, this novel coronavirus, and launched protests in Michigan and Washington, and out here in California, it's been Orange County, I believe. Not Orange County, but I could be right about that. It said Huntington Beach. But there's been some other places where they have launched these Gridlock or these rallies where they want to go out and they want to break these stay-at-home orders. And these look like people that maybe, I'm assuming they could be maybe smaller business owners, and they're worried about not having their income or money. But what I was hearing is that a lot of problems have been where they can't access their loans. Some have and some haven't, and then some of the loans are run out, and so maybe there's anger towards that, and so it's directed towards anybody now, and they want to get back to work. And so there's a lot of people that want to get back to work, but we don't want to work sick, and we don't want to work until we find out that we're only there for a week or two, now we're dead. So that's basically it. And so it's gone from frustration to anger. So Canaan City of Colorado Mayor Ashley Smith wrote to Polis this month per Colorado Public Radio. So it will definitely be the breaking point for folks, and I'm really worried so that there could be some protesting and mutiny in the city, and I don't want it to be that way. So I think that's everywhere. That's not just in Colorado. It's not just in some of the ones that these are still photos of the healthcare worker, and you can see these photos should be iconic and should be historical, showing you how the pandemic has really cost people. You know, when I was reading an article, it was saying you're going to see how people really are and what side of the coin they're on. You know, you're going to see people who are going to be extremely generous and they want to help people. You're going to see people who are going to be rude. They're going to try to take advantage, and they're going to be trying to see how they can swindle people out of money. And that's been happening on the internet, where people have tried to lie and pretend like they're, you know, helping people through this pandemic, but they're really trying to help themselves. Steal your identity and your credit card numbers and things like that. And they're trying to scare people. People have even made up fake websites to claim that they have the cure for COVID-19, and some people have bought into it. And I heard that it's been like many people that have been suckered into that, and they've lost a lot of money behind believing that they can get cured of these diseases. These are people that probably are desperate. They've gotten ill with the diseases, and they've fallen prey to some of the predators that are online. And so it's really gotten crazy, and now you see these protester people coming out, and they're wanting to open things back up like nobody's dying, nobody's sick. You know, I even heard a woman on the news, she was saying if you're sick, stay at home. It's not that easy. We have this illness that is outside of the home, and that's where they're getting it. They're not getting it at home. They're not getting it in the just walking, and all of a sudden they start sneezing and they get sick, and it's like a regular cold. Some people think it's like a regular flu or a bad flu, and then there's some people that are really ultra rich, and they have people in high places can get them the medicine. You know, we're talking about people who don't have health care, who probably can't afford it, who might have pre-existing injuries or illnesses or whatever that are at high risk. You want these people to open up the country and possibly put more lives at risk. It's not fair, it's not logical, it's not reasonable, and it's not a smart thing to do. So protesters gathered in Denver for about 4 hours on Sunday, carrying banners and honking horns throughout the Capitol. The Denver Post reported this, and so President Donald Trump has continued to call for the country to reopen. And so that's where they're hearing a lot of this, and these seem like people that probably support Donald Trump, of course, but I'm just assuming. So he said that the U.S. has adequate testing capabilities, and last week unveiled the three-phase plan. So there's a three-phase plan for opening the country back up that the governors could enact to help Americans start life all over again. But I'm hearing it should be a little bit different than what it was. It'll never be totally the same as it was before. However, several governors said the U.S. does not have the testing capabilities or capacity needed for the states to just relax on the social distancing measures. And so the many healthcare officials have warned against jump-starting society too soon. and saying that in doing so could be catastrophic and result in a renewed outbreak. And that's what I'm thinking is going to happen. That people who are having their gatherings, they're being defiant or they're being too hasty about trying to gather with a lot of people and doing these gridlock rallies. You're going to see some of these people fall ill to this virus. We have to have something in place that is efficient and that we can rely on, and we're not there yet. Dr. Anthony Fauci. And so if you don't know who he is, he's the doctor that's usually on the news alongside of when Donald Trump is doing these briefings about what they're going to be doing in terms of the week or the month, or how it's projected in terms of what's happening with the virus, and what the outcomes or the odds are going to be. They always tend to show the graph to show you where the country is in terms of whether the curve is flattening or if it's getting larger, if they're having hot spots, or if something else is going on. But it says that the nation's top infectious disease expert, which is Dr. Anthony Fauci, says that we're not there yet, and he told that to the AP, which is the Associated Press, last week. And so this is basically the article, but I wanted to go back up to this brave guy here, who he stood in front of this car, and he basically was saying, and he's not the only one, there are other healthcare professionals that have put their lives on the line, and they didn't have to stay in front of these cars or do this, but it's a show of not only supporting the fact that they're trying to keep Americans more safe by social distancing and trying to do the lockdowns or the shutdowns or whatever, and by trying to prolong some of the time until they are able to get more testing out to find out, to get closer to a vaccine or at least treatments, something that can help people get back to work. And that's the thing that they're trying to do. But unfortunately, we have people who just never seem to understand how this thing is, and they're not in the hospital. They don't see all the people that are dying. They don't see the nurses that have gotten sick. They don't see the effects of what this does to people when they're in high risk positions. And so, even though these people are like on the front end of it and they're in the hospitals and they're in a higher infectious environment, if you're working at a grocery store, you're in a high touch area, a high area of dealing with population of public. And so that's why most of those essential jobs that are open, like Walmart, Sprouts, some of the jobs that I've been hearing they say are open, the reason why they're open is because people have been that's the reason, people have been getting sick. They're either afraid to go to those places because they know you're going to be dealing with more of the population of different walks of life of people coming in there, and you don't know who's sick, who could touch something, and then you touch it, and now you're ill. You could bring this home to your family. People are going in to buy groceries. They don't tell you that they should be at home quarantining, but they're out of their house, and they could bring this infectious disease to you and maybe hundreds of other people in the store, and now you're ill. You can't work, and now you can't even get up. You don't even have the strength to get up to go to work. And so there are other jobs other than working in a hospital that are really high risk jobs now. They're not only essential jobs, but they should say essential high risk jobs, because you gotta wear gloves. Some of the stores have like plexiglass up, and they don't got it there because it looks cute. They got it there because they're trying to protect their workers, because some workers have gotten sick. And I'm not telling you this, but I'm saying that's why in some of the stores, some of the restaurants, like McDonald's, even though the lower end restaurants, the lower wage paying restaurants, have had workers to complain they don't even have enough protective equipment to wear. So you've even heard some of the nurses in the hospital say that they're worried that they could get sick because they've had to wear the same mask over and over again for 3 or 4 different patients, and that they have ended up having to take a leave of absence from work because they can no longer come back to work because they got actually contracted the disease. And so these people don't understand how serious this is. And if you got kids or you got people in your family, maybe you're healthy, maybe or that you know of, you're healthy. But what about your kids? What about the older people in your family, your loved ones that might not have the same body as you? They may not be as healthy, that maybe older people in your family that are at the high risk stage. If you catch something, maybe you might feel like you can handle it. But what about the other people that you're going to be encountering? Maybe they can't. And so I don't think these people really thought about this. They're just being selfish and they're not really thinking clear. And then some of it is fear because they fear that they're going to lose their income. But the thing is that you have to also think about, would you rather them try to do what they can to find treatment, um, to try to see if they can work a way to gradually reopen everything so that more people can actually survive this thing out or ride this thing out? Or would you just want them to hastily open things up and risk them having to lock everything down and we stay on shutdown even longer? And so I don't think I would want to be shut down longer. I think I would want them to do what they got to do to find treatments, to find some kind of vaccine before they reopen things up too soon. So that's my feeling on it. And I know other people might still come back with something else, but I value my life and I wouldn't want to bring those type of things home to my family. And if I was thinking about anybody else, if they would think common sense wise, they wouldn't want to bring home something to their family and cause their family grave illness and maybe even death. But I'm going to play this video. I don't know if it works. If it works, it works. It might come with a commercial or maybe not. But I'm going to end this video after this video is played. But thanks for listening. Hopefully everybody will get through this. It's a rough period and a lot of people are struggling. A lot of people are afraid. A lot of people have lost jobs. A lot of people are worried. A lot of people don't know what's going to happen tomorrow. And, the biggest thing that I fear, probably if there's any fear at all, is that social disorder. So far, there's been a great order of people, and people have tried to be, how would you say, diplomatic as possible. But what I fear, in a sense, is that the social disorder will come soon. There'll be a breakdown of order in places, and they'll have to get the military involved, not just to help handing out food. I believe the military is there in case these protests become violent. And so that's the truth of the matter, because when you have so many people that file for unemployment and have lost jobs and they're worried about their next meal, that's pretty serious. So we're going through what is called, like, not only the virus being an issue, but the aftermath of this. And I would call it another reckoning, because we're also seeing inequality in these communities, and it's so evident that in the some people would say the black and brown communities, or the Latino black or African American black, Hispanic communities, the inequality in terms of the money aspect of it. The lower wage workers, or the people that work in transportation, or how vulnerable this population has been, and the highest numbers of deaths usually seem like they're people that work in the lower income jobs, because they put themselves at a greater risk. And so this woman here, I don't think she realizes what she's saying, but like somebody had commented under this article, let her volunteer in a hospital for a week or two and see, in a COVID-19 situation, and see how that feels. And maybe she wouldn't be yelling and screaming at this healthcare professional. So having said that, I'm going to start this video. So I can say is to stay safe. And until my next video, because I do have another video, and that video is going to be a little bit different than this one, but it's going to be similar, about the similar issue, but it's going to be another video that I don't think people realize, that this thing has gotten so deep that it has caused great pain here in the U.S. economically and emotionally, and so much death that now I won't even say, but until. $35,000.